Hello everyone, welcome to my channel, The Grant Specialist. My name is Chinmay, and today we'll be looking at the Preventative and Primary Healthcare Initiative by MRFF, and the fund scheme name is Maternal Health and Healthy Lifestyles 2025. So we'll be looking at guidelines for those. In today's session, we'll be looking at the structure of the initiative, which is PPHRI initiative, objectives and intended outcomes of the fund scheme, overview of the grant opportunity, key documents and resources where you can find them, eligibility, the key assessment criteria for this fund scheme, outcome snapshots over the last 5 years, some application requirements which are very specific to MRFF, and some checklist for applicants. All right, so an MRFF is usually initiative based, which is more targeted towards a particular problem that the Department of Health, Disability, and Aging would like to solve. So, this is one of the initiatives, which is the Preventative and Primary Health Care Initiative by the MRFF. In the Preventive and Primary and Public Health Care Research Initiative, we have maternal health and healthy lifestyle, chronic respiratory conditions, and targeted translation research exploration, which is the TTRA, the CRCs, and maternal health and healthy lifestyle. So today we'll be looking at the thing in purple, which is the maternal health and healthy lifestyles. So this is subdivided into three streams: stream one, stream two, and stream three. Stream three is further divided into subtopics, topic A and topic B, which we'll be looking at further in the session. All right, so objectives and intended outcomes. So the first objective is for the PPHRI initiative is essentially to enable or support research into new ways to address the preventive and public health issues in Australia. It also objective is also to support projects that identify and prioritize research that will benefit patients and their families, will improve the access and effectiveness of the drugs and interventions, improve the evidence base on cost effectiveness and comparative effectiveness of healthcare, support the development and implementation of strategies to promote health of pregnant women, adolescent children and young adults, also support the development and implementation of strategies to apply, adopting healthy lifestyles for early diagnosis and treatment at all life stages from childhood, adolescence, midlife, and to the older people as well. Right, we look at some objectives of the maternal health and healthy lifestyle. So, since we've just seen that it has three different streams, the objectives of each stream is different. So, how it works is, although it's maternal health and healthy lifestyle is a fund scheme, each stream in itself is also a smaller fund scheme. So, we go stream one, which is a targeted call for research. The objective is to develop and implement and evaluate interventions to prevent or manage perinatal mental ill health. So the stream one is all about perinatal mental health for pregnant women. Stream two is all about implementing and holistic approaches that support healthy development of children aged 2 to 5 years. That's stream two. It's only dedicated to 2 to 5 years. So if you're wanting to propose a project that looks into that sort of age gap, children from that age gap, and your project is related to developing or holistic approaches to support their health and development, we should apply to stream two. Stream three is all about adolescents and middle-aged people. So it's about developing and implementing new ways of scalable health and well-being promotions and preventative health approaches to address the risk factors in adolescents and younger adults as well as middle-aged people. So for if you're applying for one of those two sort of age groups, if your project targets them, you should be applying for stream three. One important thing to remember is adolescents and young adults are people between 12 to 24 years of age. Middle-aged people are between 40 to 65 years of age. So that is something to remember, because since they are given a clear indication of what that is, it would be very easy, or it would be very clear where to target your research project in. Right, some intended outcomes. Right, so some intended outcomes, as I said, objectives are stream based, so the intended outcome for this scheme will also be stream based. So for stream one, it is improving, since it's dedicated towards perinatal mental ill health, it's all about improving and management of perinatal mental ill health. Stream two is about development of children between ages 2 to 5 years. So it's about research improving healthy development in early childhood that supports a stronger start to life. This is its 2 to 5 years. And stream 3, the intended outcome is all about healthy lifestyles for adolescents, young adults, and middle-aged people. So it's all about that. All right. So if now we look at some overview of the grant opportunity. So we are talking about maternal health and healthy lifestyles 2025. Some key dates there. One is applications have opened on the 6th of August 2025. The minimum data is due on the 19th of November, and the scheme closes on the 3rd of December at 5 p.m. Australian Standard Time. The project duration can be anywhere between 1 to 5 years. However, the table there shows that the funding will be available. Funding will be paid by MRFF over the 3 year period, but it can be used for projects to complete to the entire duration of the project, whatever it might be. It might be 3 years, 4 years, 5 years, whatever it is. All right. So the maximum funding available for across all three streams is $30 million, which is split across three streams. So for stream one, the total funding available is 9 million. For stream two, it is 6 million, and the stream three is 15 million. Now, how it is distributed across topic A and B, that's not clear. However, overall for stream three, it is 15 million. Stream two is 6, and stream one is 9 million. So NHMRC's policy on use of generative AI, it is very critical as we have discussed in our previous videos as well. So if you include information in your application that is falsely represented due to AI not giving you the right information, the chief investigator will be held responsible for that. All right, some key documents and resources. Some key documents and resources for this fund scheme are available on Grant Connect. So one is the grant guidelines, which we will be explaining in this session. Second is the assessment criteria scoring matrix. So usually, if you look at the NHMRC guidelines, the assessment criteria and the scoring matrix, which is a rubric to score your application, are in the guidelines itself. But for MRFF, that's not the case. They have a separate document per assessment criteria, and that document I've linked it there. You can download it from Grant Connect. Then we have the grant proposal template. Grant proposal template for MRFF is a bit more elaborate. We'll have a look at it in our session as well. Rating scale for overall value and risk. Now, this is one of the criteria which again we'll be seeing in our session down in the session, that this is a non-weighted criteria. Therefore, a rating scale for this criteria is separately provided by MRFF and MRFF funding agreement. So it's a sample funding agreement by MRFF, which is between MRFF, which is the Department of Health, Disability and Aging, and your administering institution. So it would be worth having a look at some clauses around there, and how it translates to your individual organization as well. Then we have some MRFF or NHMRC's website. So since this is submitted on Sapphire, it's MRFF grant, but it's administered by NHMRC. Hence, we have written NHMRC's website there because that's managed by NHMRC. That's a link to the website directly for this Maternal Health and Healthy Lifestyles Fund Scheme, as well as there are some peer review resources, which are general peer review resources that are applicable to both NHMRC and MRFF. Application portal, as you know, this is administered by NHMRC. Therefore, the portal that NHMRC uses, which is Sapphire, is applicable for this fund scheme as well. Eligibility. Right. So in this case, we'll look at different sorts of eligibilities here. So we'll start with CIs, AIs, and partners. CIs, they must be an Australian citizen or a permanent resident of Australia, or have a valid work visa, and must be based in Australia for the duration of funding period. Now, this is slightly different to the CIA requirement for NHMRC projects. NHMRC requires them to be in Australia for more than equal to 80% of the project duration, but MRFF doesn't want that. MRFF wants them to be based in Australia for the duration of the funding project. Of course, if there are exceptions for you to travel overseas and things like that, that's okay. But in general, you should be based in Australia. Now, NHMRC projects previously had 10 CIs and 10 AIs, but MRFF has 15 CIs and 15 AIs. One of the reasons behind that is also that since it's a very targeted sort of opportunity. And if you see, there are three streams that are very targeted towards preventive and public health for across different age groups. So I think the bigger teams are allowed, and it gives opportunity for more people to be involved in grants as well. All right, now funding limits. So this is a new eligibility for MRFF. Usually, the funding limits are the critical funding limits for MRFF ones. NHMRCs don't usually have funding limits. So for except partnership projects, because the funding limit, if you have seen our previous video, it was more about matching the partner contribution here. But for MRFF, it is stream based. So for every application for stream one, there's no minimum grant amount that you can apply for in your budget. However, the maximum has to be less than or equal to $3 million if you apply for stream one. Same applies for stream two. The maximum has to be less than or equal to $2 million. And for stream three, the maximum has to be less than or equal to $3 million. There's no limit on the minimum amount. It can be any minimum amount. And for stream three, the same thing applies for topic A and topic B. It's not that topic A has lesser or more than this. So stream three, in a broader aspect, it has $3 million of maximum funding that you can apply for. All right, this is about partners. Who can be partners? Now, if you look at the NHMRC partnership projects, we did not allow universities or NHMRC administering institutions to be partners unless they submitted a waiver. But in this case, that criteria is not there. So you can have universities, medical research institutes, corporations, Commonwealth entities, federal entities, private sector companies, non-government organizations, other education institutes can be partners, healthcare providers, professional groups, etc. All these can be partners on an application. One thing is important: if you are listing them as a partner, you will need to provide a letter of support from individual partners to be uploaded to your application. We'll look at some other criteria around that letter of support down in our session. All right, now let's look at some assessment criteria. Now, it is across four assessment criteria. So if you look here carefully, we have project impact as 40%, project methodology as 30%, and capability, capacity, and resources to deliver the project is 30%. So the first three criteria add up to a total of 100%, right? Which means that the first three criteria are weighted, and the fourth criteria, which is the overall value and risk of the project, that is a non-weighted criteria. If you remember, we were just discussing in our key resources section that since this is a non-weighted criteria, we have a different matrix to score this, and that's given as a separate document on Grant Connect, which you can download. So when your application is scored, it's scored based on the weighted and non-weighted criteria. So it's there's no point in ignoring the non-weighted criteria. It is equally important as the weighted criteria. Now we'll look into each criteria in a bit more detail. Project impact. So it's a bit wordy. However, project impact is all about the extent to which your research findings are going to advance knowledge and inform policy in public health. So it's more about how does your project build on existing knowledge? How do you demonstrate consumer involvement and how that is impacting their health and their life in general, right? How does you have to demonstrate the involvement of academics, industries, and other partners into the project because joint applications are more favorable in this case. Partnerships are encouraged, so you will need to emphasize on involvement of partners, right? So if your application is focusing on a priority population, which is it can be LGBTQI plus community and so on and so forth, it Aboriginal and Torres Strait Islander people, so it has to be very clear as to how or what to what extent your project actually impacts the health of priority population, right? Demonstrate leadership, by the priority population in your project, and how their involvement has been from the get-go of the project. The second criteria is the project methodology. Now, this is also a critical criteria. It's all about what methods do you use to reach the goal. So it's all about the quality of the project. Right? What is the scientific quality? What is the feasibility? Are the aims clear? Does the intended outcome of your research align with the intended outcome of both the fund scheme, which is maternal health and healthy lifestyle, as well as the broader initiative as well, right? How the consumer involvement is there in the proposed research? Are they being involved from the get go, or what are the governance arrangements there? Are the milestones appropriate? Are the performance indicators and time frames feasible to be achieved? Again, if your project is focusing on priority population, it's more about how does your trial design involve the priority population? Are they being involved from the get-go? Are there any specific targets for the priority population, and so on and so forth? So this is very careful. Be very careful addressing this criteria. These two criteria constitute to about 70% of the total assessment criteria. So be careful on the impact and how you design your project methodology. Project methodology also has budgetary concerns in there. Is the budget, have you budgeted your project well enough to achieve the objectives, and so on and so forth. So be very careful addressing these two criteria. And the third criteria is capacity, capability, and resources. So it's primarily about the team. It's all about the team. Has the team have a great mix of skills? Does the team include individuals that bring diverse experiences and expertise? Does the research team has skills and experience to involve and support consumers? Right? Has the commitment of partners confirmed, or is there any cash or in-kind contribution to the project? Is the team experienced in that? So on and so forth. So there is a specific section in the grant proposal where you can address this assessment criteria, and we'll be talking about it a bit later in our session. The third assessment criteria, the 30% is all about the team, the 70% is all about the project, right? So these two things we have to be very careful about for MRFFs. Then we have overall risk value and risk of the project, right? So these is split across two subsections. One is the actual risk. So what are the risks that you identify for the project? How do you plan to mitigate the risks? What category does your risk fall under? Is it people? Is it legislation? Is it governance? Is it multiple risks involved, right? So you have to assess those risks. And secondly, you need to address in the grant proposal as well that you have, once the risks are identified, what strategies are you using to target those risks and solve those risks, work around those risks? So that has to be clearly identified as well. Also, one more thing that comes into this section is also a budget, which is very critical. Is it budgeted well enough to achieve the aims? And a measure of success statement. So how does your project, or what inform the measure of success? So the thing that you have mentioned in criterion one, which is your project impact, how does it inform the success of your project? How do you measure the success across the impact that you receive, and things like that? So this is very critical to understand as well. Please refer to section 13.2 if you need more information about this. That is all about grant proposal and how do you address this section in the grant proposal. Assessment process. Now, this is a very interesting assessment process for streams one and two. I mean, as you know, applications will be funded based on the rank. So there will be a score given to the applications based on the assessment criteria, and they'll be ranked, and then they'll be funded until the funding caps are reached. But for stream three, now this is a very specific one. So the top two, one in topic A and one in topic B, will be directly funded. Now, since it's $15 million in total, for the rest of the money that's there in stream three, all the rest of the applications from stream three will be pulled together and ranked in a merit list, and then the remaining funding will be allocated. This is very different compared to you know stream one and stream two. Now, for example, even after doing that, the total funding in stream three is not over. Then all the applications for stream one, two, and three will be pooled again and then ranked again, and then the funding will be allocated. It can be then any applications across any stream. All right, let's look at some snapshots over the past 3 years, because I mean We thought it would be 5 years in the start, but it's just 3 years because since, as I said, this is very priority driven, right? It doesn't run across each single year. So in our case, it ran in 2021. MRFF had released this in 2021. 2022, there was no fund scheme for maternal health and healthy lifestyle. They were not accepting any applications. Then 2023 and 2024 as well. Right, so the success rates in 2021 were 38%, down to 20%, and then 14% in 2024. Now let's look at some application numbers, which constituted to the success rates in 2021. So 29 applications in total were submitted, out of which 11 were successful. As we said, in 2022, we did not have this fund scheme accepting any applications. 2023, we had 50 applications, out of which 10 were successful. 2024, we had 63 applications, in which the success was 9 applications, which constituted to 14%. Now, if you look at the trend here, right, so the number of applications each year have been increasing over the past 5 years. However, the number of applications being funded have been decreasing, right? So the gap is going up and up and up, which means most of the people when they're applying for an MRFF, when they see a non-weighted criteria there, that's not taken seriously. So I strongly recommend you to take that non-weighted criteria seriously as well, because that informs the other areas of the application as well. So although it's not weighted, it does not contribute to the number score of your application, but it does contribute to the overall assessment of your application as well. So please do not ignore that. Right? Let's see some successful applications across the broad research areas. So in 2021, we had 11 applications successful, out of which one was for clinical sciences, one was for health services research, and 9 were for public health research, which is again a PPHRI initiative, right? So public health research initiative. So 2021, the maximum were in public health research. 2023, we see the same trend, maximum were in public health research. But last year, 2024, well, they did fund basic research, basic sciences research, clinical medicine, health services, and public health. However, the maximum was for health services research, not public health research. So these things are very critical to understand as well, that the priorities across broad research areas might be shifting as well. Right? So people might be applying for public health research. However, last year it was health services research. So it was more about more accessibility to of hospitals, of clinics to people, of medical services to people for getting better health, right? So have a think about that when you're writing your application as well. Application requirements, we have minimum data. Now, one important thing here is the stream as well. So we have eligible organization, stream, and topic that you're applying for, right? This is critical. Priority population, yes or no. We have synopsis, we have privacy agreements. Then we have research classification area and the research team. One important thing that I forgot to mention in the eligibility was, and this is very, very critical for MRFF, you can be a chief investigator only on one application per stream. If you are a chief investigator on more than one application per stream, both the applications are deemed ineligible. Right? So be very careful. So you can be a CI, not a leading CI. You might say, okay, well, I'm leading an application in stream one, and you get an invitation to be a CI on another MRFF application for the same fund scheme, but you're like, oh well, let me actually be a part of that application too. That's right, that's okay. However, one thing to note there is it's for a different stream. Otherwise, your application and their application both will be deemed ineligible. So ideally, in that case, a team of 60 people, 30 for your application and 30 for their application, becomes ineligible for that fund scheme. So it's a bigger risk. It's a very big risk. So please be very, very careful when you're doing that. All right, let's go back to the application requirements. Another application requirement is the grant proposal. Now, the grant proposal for an MRFF grant is quite detailed. We have section A, which is for project impact. It's 3 pages for that. So as we discussed, it's 40% of your total assessment criteria. So it's all about the extent to which it's going to inform knowledge. So have a look at how it does that. As we discussed previously, what should be included in that section. Section A is to write all about project impact, project methodology, and milestone and performance indicators. So these two are for assessment criteria B, which is project methodology. So in this project methodology, we have first 5 pages. It's all about the project, and then the 2 pages for milestones is about what milestone and key performance indicators have you set, you know, to ensure that the project has the desired impact that it should be, right? Then we have assessment criteria 3, which is 30%, which is capacity, capability, and resources. So team D1 is about team capacity, D2 is about chief investigator capacity, right? So in D1 you get 2 pages, and in D2 we have 1 page per CI. So this is very critical, right? Then we have section E, which is overall value and risk of the project. As we said, it has 2 sections. One is risk management plan. So it's about identifying the risk and explaining how you mitigate the risk as well. E2 is about contribution. So this is very critical. You have to only include contributions here from partner organizations and not participating organizations, right? What is the difference between a participating and a partner organization? Participating organization is an organization where the research will be actively conducted and you have a chief investigator from that organization. Partner organization is an organization that will contribute to your financially, either cash or in kind, and also benefit out of the outcomes of the project. So that is a partner, right? Participating organization is where the money goes to do conduct research. Partner organization is somebody giving you the money to contributing to your research and taking the benefit out of it as well. So no participating institution contributions in E2, only the partner contributions. Consumer involvement statement, this is very critical. If you would have seen in the assessment criteria, all the 3, 4 assessment criteria have consumer involvement statement. You have 2 pages to explain that. Please focus on including as much as you can about consumer involvement, starting from their involvement from the get-go, what benefit they will have, etc. Measure of success statement, this is to, so this constitutes your assessment criteria 1, which is about project impact as well as overall capability, right? Overall value and risk of the project. So I mean, these two go hand in hand in this section. You just have 1 page to describe the success statement. So please do diligently. Then we have references as 2 pages. So it's an extensive grant proposal to write, but it is clearly divided across different assessment criteria. I strongly recommend you to have a look at those. Other requirements, declaration of interest statements. So for MRFF, this is a very peculiar thing for MRFF. So if you have any perceived or actual conflict of interest that you foresight, please use a declaration of interest statement. There's a section in Sapphire to, it's a yes or no question. When you click yes there, it will pop up with a box to upload a interest statement. So please do that. The file name has to be surname underscore grant proportionate name, which is MRFF Maternal Health and Healthy Lifestyle underscore declaration of interest statement. There's no specific template for that, but you can create your own template. But do remember, it must be as per the formatting requirements of the grant proposal. Partner organization details. As I said, if you have a partner, there has to be a letter of support and an annual report as well, and a list of and the name of the partner investigator. So we have one section which says partner organization, and then the second section that says partner details. So when in Sapphire, so when you open partner details, it asks you for a name. So that person is actually the investigator from that partner organization, will be working on the project or contributing to the project. And then we have a letter of support which has to be on their letterhead and has to follow the formatting requirements of the grant proposal. So have a look at that. And then every partner. So there's this place there where you can have a hyperlink for annual report, or you can actually upload an annual report for that particular partner. If they don't have an annual report, which might be the scenario cases where smaller organizations are partners, the letter of support should clearly describe why that is the case. Right, then we have budget proposal for third-party research facility. So, as you know, third party research facility is an organization which is third party and they're providing service at a fee. So, if you're applying for that, you have to tick yes. It will again pop up with a window to upload a quote or a letter from the third party research facility for supporting your project. If and then if you say yes and you upload a quote, please make sure that in the budget of your application, please put in that cost in the other research cost section. Remember, in this case, the total amount that you're claiming from the funder is an eligibility criteria. As we discussed, for stream 1 it is 3 million, stream 2 is 2 million for a particular application, and stream 3 is 3 million as well. Alright, so let's look at some checklists. So before you create an application, inform your REO, inform about your intention to submit, request access to previous successful applications. So that is very critical. Have a look at how people have written their applications, how people have addressed the assessment criteria. Be aware of your RIO's internal deadlines. During your creation of your application, check complete minimum data fields, ensure it's compliant, check eligibility requirements. One more thing is very important here. Please inform your CIs to not accept applications other than for the same stream that you are applying for. They're going to accept applications or invitations for other streams, but not yours. Before submitting your application, please check your compliance and formatting are all okay. Ensure that images are de-identified. Check all the information is correct and familiarize yourself with the obligations. If your grant is successful, certify application in Sapphire and later IO submit on your behalf before 3rd December at 5 p.m. All right. So contact details. Now, although you have contact details here for NHMRC, the reason is since they are administering the grant for MRFF, they use their same email to collect inquiries and then they forward it to the respective or relevant MRFF team. So if you have guideline clarifications, please email help@nhmrc.gov.au. Their phone number is 1-800-500-983. For international callers, it's 026-217-9451. If you have glitches or issues with Sapphire, please reach out to the same contact details. If you have eligibility questions, please contact your RAO. Now, if even though you think you don't have a question on eligibility, even you think you don't, everything is okay, it's always worth checking with your RAO once that whether all the CIs look okay from the eligibility perspective. The RAOs will have additional accesses in Sapphire, but they can actually have a look at which CI is exceeding limits, which CI can't, which you cannot see as applicant. So I would strongly recommend reach out to them. In terms of advice on writing your applications, reach out to peers in your area of research, local area funding specialists in your universities or research institutes or wherever you come from, and or the RAO in your institutions. Remember, NHMRC does not respond to any queries after 1 p.m. ACT. ACT is in capital territory, which is Canberra local time, on the 3rd of December 2025. All right. If you have any questions, please comment down below. And please do not forget to share this, like, and subscribe to our channel. Please share it with your other research colleagues as well. And yeah, if you have any questions, as I said, please feel free to reach out. Thank you.